In the first section of our lecture topic, antenatal care, we will talk about what's the routine antenatal care. In this section, we will talk about pre-conceptual care, vitamin supplementation, and what are the risks of substance abuse in pregnancy. So, routine antenatal care. The aim of routine antenatal care are the care before the delivery. Natal is the time of the delivery. So we have antenatal before the delivery and postnatal after the delivery. So these are the few terms very commonly used in the during the pregnancy period. So one is natal, antenatal, and postnatal. So antenatal is the before the delivery, how we should take care of the pregnant women during the 9 months of pregnancy. So the outcome of the pregnancy should be good outcome, and we should limit the complications after the delivery and limit the complications of pregnancy. So it's very, very important to have a routine antenatal care. The aim of this is to ensure optimal health of the mother and the baby through the pregnancy and in the puerperium. Puerperium is the time after the delivery, and it's the through pregnancy and the puerperium. Detect and treat disorders arising during pregnancy that relate to the welfare of both the mother and the baby. So it's very important that we should routinely examine the pregnant women, and this is to avoid any complications and disorders during the pregnancy and for the well-being of the mother and the baby. Antenatal visits, there is a routine set schedule of the person or women who visit during the antenatal period, that they should come monthly from 8-week gestation to 28 weeks. So from the 8th week to 28th week, the antenatal visit should be monthly until there is some complication. So it's for the routine normal visits or routine normal pregnancy. If there is some complication, any spotting, if there is any pain, pregnant women should always visit their obstetrician. So from 8th week to 28th week, it's monthly. Then after 28 week, it's every 2 weeks until 36 weeks. And after that, it's weekly until the time of delivery. So first monthly, then 2 weeks, and then weekly, close to the time of delivery. The visit should be every week. Provided by general practitioner, midwives, and obstetricians. So depending on where the person is or where the pregnancy is occurring, sometimes midwives do the examination, but mostly these are the obstetricians. Pre-conceptual care and vitamin supplementation. Undertake screening tests and provide advice regarding conception and early pregnancy care. So it's important if some female is regularly seeing the obstetrician to get pregnant or to conceive, usually it's important to give them advice regarding how to conceive, what different precautions and measures they should take to conceive, and how they should take care during the early pregnancy. Different screening tests should be performed, like screening tests for different infectious diseases like rubella, syphilis, screening for diabetes if they have. So all these are important measures to take before conception. Assessment of the need for immunization for rubella, varicella, and pertussis is important. Any immunization history, if they are vaccinated against these illnesses or they are not immunized. So immunization history should be taken on the antenatal visit and should be taken as a pre-conceptual history also. Dietary and vitamin supplementation and maternal medical conditions. I always ask about the any history of illnesses in the mother, if they are taking any medications, if they have any illness or disease. Then risk of substance abuse in pregnancy. Smoking can have different effects during pregnancy. Usually it's because of the effect of carbon monoxide on the fetus, effect of nicotine and smoking cause the uteroplacental vasculature constriction, and constriction of the blood vessel usually cause decreased blood flow, and this can cause hypoxia, ischemia, and even cause fetal death and fetal abnormalities. Then effect of smoking on placental structure. Smoking can cause very commonly placental abruption or separation of placenta from the uterus wall, and this can cause a serious emergency, and even fetus or baby can die. So it can cause abruptio placenta, and it can affect perinatal mortality. So, and then the other commonly used drug is alcohol, especially in the Western countries. Lot of females, they use alcohol during pregnancy, and it can have wide range of effects. It is associated with syndrome known as fetal alcohol syndrome. And the clinical manifestations are growth retardation, various structural defects and facial defects occur in fetal alcohol syndrome. Then there are multiple joint anomalies and cardiac defects also occur in fetal alcohol syndrome. Fetal alcohol spectrum disorder, it affects neurodevelopmental and behavioral effects attributable to alcohol consumption in pregnancy in dose-dependent manner. So it's dose-dependent, very small amount, usually it's not associated with the serious complications. But if somebody who used the alcohol in lot of amount and they are like use it every day, usually the complications are very serious. These are all the facial abnormalities that are associated with fetal alcohol syndrome, like low nasal bridge. There is minor ear abnormalities, indistinct philtrum, micrognathia, small chin or face, epicanthal folds, this short palpebral fissures, flat mid-face and short nose, and thin upper lip. All these are the facial structural abnormalities associated with fetal alcohol syndrome, and especially associated its dose-dependent effects, how much is consumed and how often it is consumed. Then some other illicit drug use during pregnancy, drug abuse from heroin, amphetamines, cocaine, and marijuana. These can cause effects on both the mother and the fetus. The use of heroin is associated with increased incidence of intrauterine growth restriction, perinatal death, and preterm labor. So heroin has different effects. Amphetamine again is increased risk of miscarriage, preterm birth, growth restriction, placental abruption. Abruptio placenta, as I already mentioned, it's separated from the uterine wall, leads to very bad hemorrhage and pain, and the blood, supply of blood and nutrition to the baby is affected. There is fetal death in utero and developmental abnormalities. So amphetamine use during pregnancy also have serious consequences. Cocaine leads to cardiac arrhythmias, central nervous system damage in mothers, as well as placental abruption, fetal growth restriction, and preterm labor. And marijuana causes teratogenic effect. It can have very bad effect on the baby, so all these illicit drugs or street drugs can cause serious complications in the mother and in the baby, can cause growth retardation, cause preterm deliveries, and even cause some mental retardation, heart abnormalities. So all these complications can occur. So it's very, very important to avoid these drugs during the pregnancy. So that was all about the use of different drugs and effect of abuse and effect of smoking and alcohol on the baby and on the mother, and what's antenatal care and how often it should be done. Thank you for watching sqadia.com.